Hi, this is your Houston chiropractor, Dr. Gregory Johnson. And many of you have asked to see a follow-up on Johnny's case because he had severe chronic debilitating pain and has been disabled since 2005. He had cervical spine surgery, went through chronic pain management programs, physical therapy programs, all kinds of narcotics, hard narcotic medications, and has been unable to get around for years now, 2007, without a cane since his surgery. But I want to show you his progress. So let's close your eyes, flex your head forward and backwards. Now see, his range of motion's increased, but it's still limited. You can open your eyes. You can see his head's still a little bit forward, but it's way back up from what it used to be. He's still got a translation on the x-axis to the right. He's also got a rotation on the z-axis to the right. You can see how high his left shoulder is, but it's a lot lower than what it was. And also, look at his fingers now. Look where his fingers are straightening out, and if you look in the other video on him, they were all curled up in a trigger finger type of an action. Is this the straightest they've been in years?
Yes, sir.
Very good. Okay. Now, let's come over here and have you come down on the table. And see, he's actually walking on his own power without the use of a cane. And we've been getting them to do that, and he's swinging his arms even. And watch how much easier he gets down on the table now compared to the first time when he could barely even get on the table. Very good. We still take it slow. Now, he's still in quite a bit of pain. We're not there yet, but we're making a lot of headway. And this is only his 7th treatment. 7th treatment. His leg was a ½ an inch short, and now it's exactly even. I'm going to bring his legs up. Now you can still see that there's quite a bit of restriction in this left one with the knee, but look how much we go up with the right one compared to when we first started. Now that still tightens up a little bit in his sacroiliac joints. So we're going to be adjusting those first. This is the right sacroiliac joint, straight down on the sacrum in a superior to inferior y-axis as well as the z-axis. Very good. Now I'm going to hit this right SI one more time because he's got a lot of rotation there. Now right here is L5. We're dropping that one straight down in the z-axis. L4 straight down the z-axis. L5, L4, L3, L2, and there's L1. And now we're just going to have him breathe normal. There we go. And we're getting some just nice, gentle mobilization in his mid-thoracics. This is a Palmer diversified adjustment. You notice that I'm putting torque into my hands when I adjust this area. Now, up here has been his hugest improvement, so just let me have this here. Look at that. He's had cervical spine surgery, and we got movement all the way up his cervical spine. And on this, just let this go in my hand here. Excellent. Now, we've still got a big old trigger point in this left trapezius muscle. That's pretty tender still, huh, Johnny?
Yes, sir.
And all the way into his levator scapula muscle, which goes from his cervical spine to his shoulder blade. But wait till you see the difference in his posture and his movements and activity following this treatment. Now he's been completely disabled since 2005. He had surgery for his cervical spine that failed in 2007. And he's been unable to work, been unable to travel, drive, even have a life for that matter, up until this point in time. Very good. Now, let's go ahead and have you turn right on your back for me, please, sir. Take it nice and easy. We're just going to have you roll over like you do normally. There we go. he's got a lot more strength now than what he had originally. He's actually able to even move around and get turned around. Just make sure he doesn't fall off the table. We haven't lost a patient on the floor yet. We don't want to start with him. You're doing good.
Yes, sir.
Doing good. Right there. Perfect. Now, go ahead and just relax your hands right here on your tummy. Now, even though he has a cervical spine surgery and fusion, watch this. Just relax this in my hand. There we go. And here's his atlas on the right. Perfect. Good job. Now, I am going to be decompressing his hip joint and all the way up into his sacroiliac. There we go. Felt that all the way up, didn't you?
Yes, sir.
And same thing here on this left side. Excellent. Very good. Okay, now, here's what I've been doing to rehab his fingers. Okay, now, I want you to push against me with those. Push real hard. There we go. Now, this is painful because his hands have been drawn up for how many years now? 8 years his hands have been drawn up. You notice this is not comfortable for him. But when he's relaxing now and breathing, look there, they don't draw up on their own. See? Before they were trigger fingers drawing up. So we're getting an increased nerve supply through his cervical brachial plexus, through the median nerve, all the way down into his hands and fingers. Now, let's have you come over here and stand up in front of the mirror. Yeah, just bring this guy over here. There you go. And we're going to have Renee stand in front of him again. And I'm going to do the most sophisticated neuromuscular re-education technique in BioPhysics on him right now. Those hands relaxed. There you go. Good man. See, he's getting around a lot better already. I'm going to grab my instrument here. Okay, now step forward just a little bit more for me. Spread your feet a little further apart. That's good. Now, here we're going to mirror image his biomechanics. So, I'm going to have him lift his shoulders up. We're going to hold those way back. Out. Turn your hands out. Remember, no, flip them out. Like this on both sides. Now see, he's still got a lot of drawing there. But here, we're going to pull that up and back. Now, I am going to translate his neck left. Now, I want you to tilt from right here for me, Johnny. Tilt right there. We're adjusting his atlas right now on the x-axis. All the way down into his thoracolumbar and lumbosacral spine. Now just relax. Very good. Now close your eyes, flex your head forward and backwards again. Much better range of motion. And voila, look at this. This is after 7 treatments of a man who's been disabled since 2008. How do you feel right now compared to all the other treatments you've had, Johnny?
Pretty good.
Yeah. Do you feel like you're getting your life back?
Yes, sir.
Praise the Lord.
Praise the Lord.
We're very, very happy that he got referred here by another lady who had 4 failed back surgeries. So this is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.